So I'm going to continue on with our nose lectures, and happy April Fool's Day, by the way. Anyway, so we've covered a lot of topics already. Reduction rhinoplasty, augmentation rhinoplasty, twisted noses, finesse noses. Today I'm going to talk about when we do rhinoplasty and then come back several months later and do what we call Alar Rim surgery. Now, Alar Rim surgery is where I make an incision underneath the, right in that crease through here, and I use it to remove a portion of the nostril, or what we call the nasal sill, which is under here, or a combination of both, depending upon what I'm trying to achieve. So that is not done at the same time as a rhinoplasty because of several reasons. Number one, if I do 100 rhinoplasties, I'll only come back and work on the nostrils in less than 5% of patients. So that means 95% of my patients are perfectly fine without Alar Rim surgery, and it does take 45 minutes or so to do Alar Rim surgery, so I got to charge for it. So I'm saving 95% of my patients unnecessary expenses. That's not a bad thing. Number two, when you change the shape, and particularly when you rotate or deep project or make the tip go this way or that way, or you change the shape of this part of the tip a lot, you're going to affect the shape of the nostrils in an unpredictable way. So you don't want to be doing this procedure when you're doing this, because the shape from here to here is going to change, and sometimes mildly, sometimes more dramatically, depending on, again, what we're doing. Reduction rhinoplasty, for instance, tend to get more of a change in the shape of the nostril than you do with other procedures, but there's other variables involved. So when you do this procedure, you're actually taking off a portion of the nostril and throwing it in the garbage. So obviously, and then reconstructing the nostril. So obviously, if you do that in haste, let's say, at the same time as your nose job, and you get it wrong, well, you can't fix it. And that's it. So you want to be very precise when you do this. Just do it when it's absolutely necessary. Do it when you're not having a nostril that's going to be changing shape on you. And finally, you can do this procedure under local, at least most people can. So it's a very patient-friendly procedure, very little bruising, very little swelling, and just visible incisions for 6 days. So without any further ado, I'll show you some examples of patients that have had a rhinoplasty with Alar Rim or nostril surgery. So this first patient is a 20-year-old patient who's 1 year post-op. You can see that she had a reduction rhinoplasty. She has some South American heritage to her, so we got her nose looking pretty, and then came back and did her nostrils. She had a combination of what we call a nasal sill and a weir procedure, so that helps with the width and the overall shape of the nostril. This is another young lady who is 1 year post-op. She's 37 years old. She also had mainly a nasal sill, which helps with the width procedure. Width of the nostrils. You can see it's very difficult to see the scar that heals very nicely. And in general, that's another reason why you do it after the rhinoplasty and not at the same time. So the next patient is 41 years old. She's 8 months post-op. She had not only Alar Rim surgery, but also cartilage grafts, especially on this right side, what we call an Alar batten, to help lower the curve. So she was a complicated one, but turned out very nicely. This next patient's 28 years old. She is 5 months post-op. She has marked asymmetry of her nostrils pre-op. So we knew that we were going to have to do something to her nostrils. Again, another reduction nose, but the symmetry of her nostrils now is much better. It fits her the thickness of her skin and the rest of her face very well. Again, she was a combination of a leader and a nasal sill procedure to get the final aesthetic result. This last patient is 43 years old. She underwent an augmentation rhinoplasty, and then several months to a year later had her nostrils done. And so she had to have her nostril shape changed with lateral curl grafts at the time of the primary rhinoplasty. And then when she was healed and we had the tip symmetry where we wanted to and swelling where we wanted, we did her nostril surgery to give her the final pretty result that fits her face well.